Dr. Angelina Postoev. All right, I think I got that right. She has made it her life mission to educate the masses on the importance of obtaining and later maintaining a healthy weight to mitigate future health issues. Dr. Angelina is a proponent for bariatric surgery as a means for her clients to finally obtain a healthy lifestyle. Hi, Dr. Angelina. Thank you so much for joining us today.
Good morning. It's so nice to be there with you.
Oh, I'm so happy. You know, now I'm going to tell you, I am fascinated with this subject because I watch on TLC, My 600-Pound Life, the 1,000-Pound Sisters. I do the whole thing. And it's sad. These people are really suffering. And I just can't imagine that being my reality. Why do you think, for the most part, that how is it that, but a lot of us who are not morbidly obese do not understand how people get to be 600 pounds. How does that happen, Dr. Angelina?
Well, there are so many factors, and I think if you look at the history in America, I think back in 1970s, there was a lot of changes in the way people were eating and the way our environment changed. Of course, I was not around in America during that time, but it's clear that that's when kind of industrial, it's not really industrial revolution, but the food changed. Processed food is everywhere, hormones, additives everywhere in the food. Everything started getting bigger, right? Everything is supersized.
Right.
And now all of a sudden everybody's snacking every day. We're not moving as much as we used to, right? We always in a car, we sedentary. But again, it's not just diet and exercise alone that's going to change things. It's everything, right?
Right.
And another thing you mentioned, I know you mentioned 600 pounds, 1,000 pounds, but the thing is we become obese for average height person over 200 pounds, right? For most people, when I say 200 pounds plus, we know we're talking about obesity. Once we start going over 250, it's morbid obesity. So you don't have to be that extreme to feel the effect of extra weight.
And I was thinking about, you know, my vanity sets in a lot. You know what I'm saying? At one time I was always no more than 115 pounds. And then menopause came. And then I just went right past saw an image of myself through the window. And I was like, who in the hell is that? And I'm going to tell you, I couldn't carry that weight. I couldn't carry it. I was uncomfortable. Isn't that enough for people to want to lose weight? Just being uncomfortable.
Yes, but it's not so simple. For a lot of people, they grew up. Not everybody, been trained as a ballerina. And not everybody has that control. Some people don't have the access to correct food. They don't know growing up what to eat, what not to eat. And yes, they start feeling uncomfortable. But they're like, okay, I'm big boned. That's fine. I like a little bit. I like a little hip. I like a little breast. That's fine. I mean, I like that on me. But then it gets more. And as you said, as you get older, once you hit over 40, once you get over to that, close to that menopause, our metabolism changes. Maybe you used to work out and eat crazy, but then you stopped working out. You keep eating crazy.
So what?
Right? That's a very common problem.
So what does?
And it keeps adding and adding, and then people get discouraged.
Right. So why bariatric surgery? It would seem to me that if someone was going to have bariatric surgery, that they would also at the same time have some type of counseling so that you learn why you eat the way you do and that sort of thing. So, Dr. Angelina, is that what you do with your patients? Do you that want bariatric surgery? Because it doesn't make sense to go through the surgery and you keep doing this and having the same, doing the same thing that you did before the surgery. It's a waste of money.
Absolutely. I mean, the counseling and education is the main part that we need to do. We have nutritional counseling in our program where we educate people. We have support groups where we want to educate people before they get to the surgery what about to hit them, what we're about to do. Because the surgery is just a tool. Same as exercise and diet, except it's exercise, diet forever. And now this is an extra tool to help your body. We treat obesity same as we treat diabetes or high blood pressure. This is not one-time done deal. This is forever, and you have to maintain it forever. You have to follow up forever. Same as diabetics, because I think much more people kind of accept and understand diabetes a little bit more. You don't go to the doctor one time a year or one time in 5 years and say, okay, where's my medicine? And that's it. No, you're going to check your sugar every day. You're going to go to checkups every 3 months to check your blood sugars and your blood levels for the sugar. And the medicine is going to get adjusted. You're going to talk to a doctor about what you're going to eat, what you're not going to eat. Obesity is the same. It's a medical condition that needs to be treated in the same way.
Wow.
It's a forever condition that you have to maintain.
So let me ask you this. Before you agreed to do a bariatric surgery on someone, do you ask them ahead of time, like maybe a month before, let's see if you can lose 15 pounds or 20 pounds or something like that to show where their head is at, if they will continue with the plan?
We don't necessarily require specific numbers. Some programs do. There are some programs that do require that. So it depends, on insurance and how we're doing it. But in general, yes, we want to make sure people understand there's certain clearances they have to go through, certain understanding that you can understand which foods to eat. And we actually have patients go on a special diet a couple of weeks prior to surgery, both to help with the surgery, with shrinking certain organs inside, like their liver, but also to get their body used to not having full meals of food. We absolutely want people to learn that little portions are good and that you can survive. I always tell people, look, you ate only this little today and you survived. Like, we do not need those huge portions of food. And for some people, it's as simple. For some of us who've maintained the weight all our life and worked on it or worked out, we kind of understand, okay, this food is good, this food is bad. There are a lot of people who don't know the difference. They think, a lot of fried food or a lot of oily food. Well, I ate this all my life. This is good for me. What are you snacking on? Potato chips. Well, you're not really supposed to be doing that.
But they have an addiction too. I mean, how much of this is? Do you all think, any of you think that you have an addiction to food? I've had an addiction to food since I was a kid, but I was an active child, and I was an active teenager, and I was just small. My people are just small anyway. But do you think that it's true that some people just have an addiction to food? 773-591-1690. Talking to Dr. Angelina Postoev, and she is the founder of Surgicare Arts and Aesthetics and co-founder of Georgia Surgicare. She is a triple board certified by the American Board of Surgery, the American Academy of Cosmetic Surgery. She's triple trained in a licensed cosmetic general surgery and critical care surgery, and she is committed to providing exceptional surgical treatment by using advanced technology and procedures in a state-of-the-art surgical facility. I need you to be my best friend so that anytime things go wrong, Dr. Angelina, you can fix me.
Anytime.
So like I was asking, do you think that Americans specifically, we are addicted to food? I mean, just look at the portions compared to what I see, when I travel the world. They're huge.
Absolutely.
Where are you from originally?
Russia.
You're from Russia, and they don't eat like we do here in the United States.
They probably do now.
Really?
I left back in the 90s, but yeah, back then we had trouble just accessing food, period.
Right,
we had trouble finding it.
Right.
So there was none of this things that I struggle with my kids nowadays where they just, I don't want this, I want that. I was like, look, when I was growing up, it is what it is, and if you don't eat it right now, it's going to be gone, and there'll be no food.
Right, right.
You ate what's in front of you. But a lot of it was more natural grown foods, not chemically, genetically modified. Definitely, we did not add corn syrup and fructose to every little thing in the foods because we didn't have preserved food. Everything was fresh, and then, like milk, you bought milk, unless you boiled it, it would go bad in 2 days, right? We didn't have this food storage thing that's happening. Yeah,
you didn't have the refrigerators and the freezers.
We had refrigerators, but everything you buy, you cook. You go to the store next day or 2 days later to buy more food. Everything was just kind of fast-paced and fresh, or none, or we didn't have any. Right. Nowadays, because of the preservation of food and all this addition of sugar to everything, the starch, the corn syrup, the fructose, refined carbs. That really triggers the same centers in our brain that tells us that we're having pleasure, our pleasure centers.
Okay.
The refined carbs and fructose, they'll trigger the same pathways in our head, the addiction centers. Right? And when our brain feels the pleasure, right, it's going to say to give me more. So I feel like carbohydrates, sugars, they're more addicting than actual narcotics.
Wow. So tell me how many people, are people coming to your practice more for the bariatric surgery? People used to be reticent. They don't seem to be too reticent as they were maybe 10 years ago. People are getting this kind of surgery, aren't they?
Absolutely. It's getting more acceptable. Again, it's a medical condition that's treated with, surgical procedure. Same as we do for cancer surgery or any other, bad gallbladder, bad appendix. We go surgically, we remove the part, we fix it, we make you better. Bariatric surgery should be looked at in the same way. It's a tool that will help you get better and get rid of your diabetes, get rid of your hypertension, high blood pressure. I still see a lot of patients, and it also depends on the community. In some communities, they feel like, oh, you're doing the bariatric surgery, you're getting, easy way out.
Right.
Well, yes. It's not an easy way. It's a tool that you're going to work hard with, but you're going to make yourself better.
So with the bariatric surgery, is that where you remove part of the stomach? What is bariatric surgery?
There are several types of surgery. It's a weight loss surgery. Simply put, it's a weight loss surgery. There are surgeries and procedures that's available. We keep advancing technologies out there, so we keep adding new procedures. The most common that people heard about are a bypass surgery. What it is, we staple the stomach to make it look very small, and then we bypass some intestines, kind of reroute the intestines inside. So the food, one, you cannot put too much because the pouch is so small now, the stomach is so small now.
Right.
And two, the food will bypass a whole bunch of intestines, so you cannot absorb the food. So it's kind of like a little detour for the food to go around most of the intestine. The second, and which probably the most common surgery nowadays, is gastric sleeve or banana stomach. We make stomach look like a banana instead of like a big bag.
Oh.
And we're literally making the stomach smaller.
Wow.
And that's more popular because there's a little less risks. And then we have procedures where we don't cut anything at all. We just sew the stomach up on the inside with the camera. We go through the mouth. We don't even cut the stomach at all. We don't cut the abdomen. We just go with the camera into the stomach, and we can sew the stomach up to make it look smaller without cutting or no surgery. It's a procedure.
And we've been talking to Dr. Angelina, who has been talking about bariatric surgery. Unfortunately, a lot of people in America are obese and even morbidly obese. And that's part of the reason why so many people have died in this pandemic because of the weight. How does COVID-19 impact people who are morbidly obese if they contract the virus, doctor?
The latest studies actually did show people with obesity were more likely to die from COVID. So it was one of the major risk factors. We actually had a lot of people come in during this year to get their surgery. They finally pulled the trigger and they said, it's enough. I have family members who died of COVID, were found at home because they were morbidly obese. And the body just cannot handle it because it affects every organ in your body when this happens. So any extra stress will increase the risk. On top of it, when somebody is morbidly obese, they usually have other medical problems with it, right? Obesity doesn't come by itself. Otherwise, nobody will really care so much, right? It increases your blood pressure, your diabetes, your other medical problems that, again, puts you in an even higher risk for COVID problems, right?
Okay.
Because having COVID by itself is not a problem. It's dying from COVID that's a problem.
Right.
And so all of these things add up. And obesity just makes it so much more supersized. All of those little problems will add on top of each other.
All right, Dr. Angelina, you've scared me to death. I'm not going to feel like I'm in a sausage casing by July 1st. I'm going to lose this little 10 or 15 pounds. How do people find you, Dr. Angelina? Do you have a website so people can see the kind of work that you do?
Absolutely. We have several, but the simplest one to find is idealbodyinstitute.com. And the second one is surgicarearts.com.
All right, then. What a pleasure to talk to you, Dr. Angelina. I learned a lot today. Thank you so much, and stay safe, and good luck to you and your family.
Thank you so much. It was a pleasure.
All right, then.